Good evening. My name is Christine Smith, and I will be going over medication discharge education this evening. My patient is going to be Mr. JD. Good evening, Mr. JD. My name is Christine. I'll be your nurse tonight. Can you verify your name and your date of birth for me, please? Thank you. I see here that you're going to be discharged this evening, and I just wanted to go over some medications with you and make sure that you understand how you'll be taking them. I see here that you have a history of hypothyroidism as well as GERD. And during your stay here in the hospital, it looks like you are newly diagnosed with type 2 diabetes. And we are also going to be treating your hypertension. Is that correct? Thank you. And confirm for me, your home medications are Synthroid 100 micrograms daily, as well as Protonix 40 milligrams daily. Thank you. And it looks like the new meds that we're starting you on are Lopressor 50 milligrams once a day, Zestril 10 milligrams daily, as well as Metformin 500 milligrams daily. All right. So let me go over some of those meds with you before you head out. So you're going to continue taking your Synthroid and your Protonix like you were at home. The Synthroid, is for your hypothyroidism, and the Protonix is for your GERD. Let's see, I've got your paperwork here. So with your Synthroid, you want to make sure that you report any racing heart, any abdominal cramps, any diarrhea, any vomiting, as well as insomnia and weight loss. And be sure that you avoid grapefruit juice when you take your medication. And you also want to take that Synthroid first thing in the morning on an empty stomach. Take it with a full glass of water before you eat any meals, about 30-60 minutes before you have breakfast, okay? You also want to make sure you check your blood pressure and your heart rate, especially your heart rate prior to taking that medication. And I'll go over how you're going to check your heart rate at home, okay? So some of the side effects that can go along with that, some things that you might want to report to your provider is if you start to feel like your heart is racing, if you're having any chest pain, if you notice that you're having difficulty sleeping at night, any diaphoresis, which is like profuse sweating, as well as weight loss or tremors. Report those immediately to your primary care doctor, okay? Once again, make sure you take your Synthroid first thing in the morning, before you have breakfast, before you take anything else. If you miss a dose, try to take it as soon as you remember. Otherwise, skip that dose and take the next one the following day. If you skip more than 2 or 3 doses, make sure you follow up with your primary care doctor to discuss that. Next, I have your Protonix here, which is for your GERD. You want to make sure that you're checking your sugars since you are a new diabetic, and we'll go over that. But you're going to monitor your sugar. You're going to report any diarrhea. If you start to have diarrhea that won't go away, any abdominal pain, any burping that just won't go away, any gas that's not going away, as well as any headaches that are lasting an abnormally long, amount of time. Excuse me. Also, if you notice any blood in your stool, or if you start to vomit or you're burping up any blood, make sure you report that as well. And if you start to have any fevers, you want to take this medication as ordered by your provider. Finish the whole course of it. Even if you start to feel better, don't stop taking the medicine. Continue to take it. And then once you follow up with your primary care doctor at your next visit, you guys can discuss your medication. You want to avoid alcohol, medications containing aspirin as well as NSAIDs, and any medication that might upset your stomach. Also, report any dark, tarry stools, any blood in your stools, any diarrhea that won't go away, abdominal pain, cramping, or fever. All right, so those are the meds that you're already taking. So here's one of your new meds that you're going to be starting. It's called Lopressor metoprolol. It is for your blood pressure. Before you take this medication, you're going to want to check your heart rate and your blood pressure. And you're going to do that. You're going to check your blood pressure a couple times a week, but you want to make sure you take your heart rate, check your heart rate each time before you take your medication, okay? You're not going to get the full effects from the medicine for about a week or so, all right? Being that you are a diabetic, you're going to make sure you monitor your sugars, and you're going to check for any signs of hypoglycemia, which I'll go over all of that as well. Hypertension medication can cause an adverse effect, which can lower your blood pressure. So you're going to make sure you sit up slowly when you're getting up, and you're going to monitor for any lightheadedness or any dizziness, and you're going to report that. You're also going to report any blurred vision that may happen, any constipation, any diarrhea. Dry mouth is another side effect that can go along with this medication, as well as nausea and vomiting. And erectile dysfunction, unfortunately, is a side effect from this medication. So continue to take your medication. If you notice any effects that don't fit your lifestyle, or you're not liking these side effects, then go ahead and contact your primary provider for a consultation to maybe switch some things up. So you're going to get yourself a little portable blood pressure monitor, and you're going to monitor your blood pressure 2-3 times a week. You'll follow directions right on a package. You'll put your blood pressure cuff on. You'll rest your arm on a flat surface, kind of level with your heart, and you're going to start that machine, and it's going to check your blood pressure as well as your heart rate. You can also check your heart rate manually by using your 2 fingers, and you're going to feel for your radial pulse. And once you feel that, you're going to count that for a minute. And you're going to document that each day. And when you follow up with your primary care doctor, you are going to bring that to him so that he can see what your trends have been, all right? And if he has any, if your heart rate is less than 40, you're not going to take that medication. Usually it's less than 60. If your heart rate's less than 60, then you're usually going to follow up with your primary care doctor and see if he wants you to hold that medicine or not. Some things that you might want to report to your provider is if you start to have a consistently low, slow heart rate, you're going to report that. Any difficulty breathing, any wheezing, if you start to have cold hands and feet, if you start to notice that you're becoming dizzy and lightheaded more often, any confusion, depression, rash, fever, sore throat, any bruising or bleeding, report those to your primary care doctor as soon as possible. Like I said, with the diabetes, you're going to monitor your blood glucose, and you're going to check for any fatigue, any sweating, any increased thirst, any confusion. You're going to report all of that to your provider. It looks like your provider also started lisinopril, which is also for blood pressure. So you're going to take that medication just as directed as well. You're going to monitor your heart rate, not your heart rate, you're going to monitor your blood pressure with that as well. This can also cause a low blood pressure, so you're going to want to sit up slowly. You're going to want to change position slowly. You're going to monitor for any dizziness, lightheadedness, report any abdominal pain, any nausea, vomiting, diarrhea. This one also causes erectile dysfunction, so make sure that you report that if you do have that as a side effect. You're also going to monitor if you start to have any difficulty swallowing, any difficulty breathing, if you start to notice that your face is becoming swollen, notify your primary care doctor as soon as possible, okay? One thing that can go along with this medication is a dry cough. So if you start to develop a dry cough, document it, and when you follow up with your primary care doctor, you are going to discuss that with him as well. Monitor your weight, low sodium diet. If you smoke cigarettes, you're going to want to start to quit. Monitor your alcohol consumption, limit your alcohol intake, as well as making sure you're managing your stress and exercising regularly with these medications, okay? And lastly, we have metformin. This is a medication for the diabetes that you were diagnosed with. It's management of type 2 diabetes. So you're going to take this medication as directed. You're going to monitor your blood sugar like the provider has ordered, whether it's once a day or 3 times a day before meals. You're going to check your sugar. You're going to document that, and you're going to take your medication. Some side effects with this medicine is abdominal bloating, diarrhea, nausea, and vomiting. So once again, monitor these side effects. Write them down so when you follow up with your primary care doctor, you can discuss them with him. If you start to have abdominal pain, sweating, excessive hunger, weakness, dizziness, headache, tremors, if you feel like your heart is racing or you're feeling anxious, you're going to want to contact your primary care doctor. If you start to have any chills, follow up with your primary care doctor. Also, with this medication, it is to treat the diabetes, which is an elevation in your blood glucose, so it's going to lower your blood glucose. With that, you want to be careful that your sugar doesn't drop too low. So you want to keep sugar tabs on you, honey, something that's a sugar in your pocket. So if you start to feel like your sugar is dropping, like you get the chills, you get dizzy, you're sweating profusely, you're starting to become confused, you can have a sugar, a hard candy or something to easily take. And you could drink orange juice as well to help bring that sugar back up, and then you would check your sugar and report that to your primary care doctor, okay? Any questions for me? I know that was a lot to go over. I'm going to send this packet of paperwork home with you. We're here. If you have any questions, you're always welcome to give us a call. The main thing is you want to document any side effects that may happen. You want to make sure you're monitoring your blood pressure and your heart rate. You also want to make sure you're checking your sugar on a regular basis. And noting any side effects that come along with these medications and report those to your primary care doctor, okay? All right, if you don't have any questions for me, you are good to go. I wish you nothing but the best. And once again, if you have any questions or concerns, feel free to give us a call. All right, thank you.